Transforming care through genomic medicine, personalized therapeutics, health services and outcomes research, and innovations in healthcare delivery. We're Children's Mercy Kansas City, presenting our audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
Our topic today is screening for early detection and treatment of scoliosis. My guest is Richard Schwend. He is the director of the Orthopedic Research Program at Children's Mercy Kansas City. Dr. Schwend, welcome to the show.
Yes, hi, Dr. Mike.
So let's talk first about exactly how we're defining adolescent idiopathic scoliosis.
Yes, so I think the name adolescent idiopathic scoliosis pretty much describes it. It's a condition in adolescence. It comes with when kids start to reach their growth spurt. Idiopathic means they really don't know the cause of it, although there's a lot of exciting research about some genetics associated with it. And scoliosis just means a deformity of the spine where there's a sideward bend and also a twist to the spine as well.
And so who is mostly affected by AIS and where, some of that, and where is some of the research looking mostly into as a cause? Is it a genetic component to this that we're looking at more, or is there something else that you think is causing this?
Oh, okay. So about 3% of children under 16 has adolescent idiopathic scoliosis. So it is, somewhat frequent in families. There is a genetic tendency, and what I mean by that is it's not there's like one specific gene, but they're finding out that there's many genes that can be affected. And for instance, one gene might send signals for muscle development, and another gene might send signals for nerve or connective tissue development. And so all of these different genes can be affected and influencing how the child's spine develops and grows. And so it's a very complex system how the body develops. And so that's, I think, where most of the exciting research is happening.
And so when we look at, so we have that side of research going on, looking at the actual cause, the genetics. But what about today, and what are we doing for adolescents today with AIS? I mean, what research has been presented recently, say, for early detection and management? Okay.
So I'll get with the management first. Children's Mercy was involved in this National Institutes of Health funded study. It was a multi-center study. There was over 25 studies in sites in North America called the BRACE study, and the BRACE means bracing for adolescent idiopathic scoliosis trial. And what that study did was it took some children and with scoliosis and with consent from the family and the child, put them in a brace for the treatment of their scoliosis, and then some children were not treated to see if there was a difference in the actual use of the brace in stopping the scoliosis. And because the number of centers were involved, we were able to come up with a couple hundred children that participated, and they were able to show that bracing is very effective if you wear the brace.
So was the brace applied maybe in an earlier time setting than previous bracing? Is that really what we're finding out, that once you see that, applying the brace, if the patient's compliant with wearing it, that's the positive result?
Yes. So what they found was the earlier you could apply a brace, like for instance the smaller a curvature is, the brace tended to be more effective. And also, if you had to wear the brace a certain minimum number of hours. And so this is a plastic brace that fits under the arm, so around the trunk. If you needed to wear the brace at least about 12 hours a day, and probably 15 to 18 hours was the ideal amount to wear the brace. And these braces, you have the children would typically wear these at least a year, more likely about 2 to 3 years. So
in this situation, we recognize now that the earlier the the brace is used, and of course you have to have the compliance, the better the result, as we just stated. That means, though, we need to be detecting the AIS earlier, right? If we're going to be able to really, use this kind of data. So what are we doing in terms then of recognizing AIS in children earlier?
Oh, so that's a very good question. So I think a lot of it is awareness on the family's part. If one of their adolescent children has a deformity, or their spine doesn't just quite look right, I think the most important thing is to have the primary care doctor evaluate the child, because they're trained to then examine the child more specifically. And also during like school physicals and sports physicals, when the child comes in during the adolescent years, the primary care doctor or the pediatrician can actually look at the back, have the child bend forward, and if they see any kind of difference on one side or the other when they bend forward, then they can get an X-ray of the spine. And if the X-ray shows scoliosis, then they can refer the child to an orthopedic surgeon that has an interest in scoliosis treatment. And then that's a very effective way to get the treatment started early.
Which we now know is extremely important based on the research the research results from the BRASS study, right? That early detection is key.
Yes, so the BRACE study showed that there is an effective treatment. You just have to start it at a time that is early enough in the scoliosis that the brace can make a difference. And that's why the early detection, both with the families but also with the medical home, is so important. With where the pediatrician or the family doctor's office, we're really encouraging that the physician use screening of the spine as part of their overall health assessment.
So, Dr. Schwend, I'm going to read you a statement that I got from Children's Mercy. It says, in a rare event, the 4 leading orthopedic societies have aligned on a combined statement on early detection for scoliosis. Can you tell us about why these orthopedic societies came together and what this statement actually says?
Oh, yes. So the reason they came together is there is a task force called the United States Preventive Services Task Force. And in 2004, based on the literature at the time of 2004, they felt that scoliosis screening was not effective and actually could be harmful, because if you're screening a lot of children and then you're getting a lot of X-rays and then you're putting them in treatment that at the time wasn't known to be effective, they felt that could be a lot of extra X-rays and over-treatment of children that may not benefit. And so the BRACE study was a very well-done trial funded by the National Institutes of Health, and that showed conclusively that early bracing is effective, which also depended on early detection. So these 4 societies felt that, and these are the leading societies that deal with orthopedics in children, they felt that the evidence was fresh enough now and convincing enough now that the 2004 statement from the United States Preventive Services Task Force should be relooked at. And so that's why the 4 societies came up together and made a statement about early detection, recommending early detection and early treatment.
Yeah, so those societies, the American Academy of Orthopedic Surgeons, Scoliosis Research Society, Pediatric Orthopedic Society of North America, and, of course, the American Academy of Pediatrics are the 4 groups that came together to make that statement. What's though? Give me the take home of all this, and how does the statement that they're developing, how is that going to affect, say, the everyday family physician or pediatrician?
Yes. So basically, the statement has five points. The first point is that there's been convincing new evidence since the 2004 task force statement, and so they're just trying to draw attention to everybody that there's new convincing evidence. Based on that, they're recommending that screening examinations of the spine be part of preventive care visits in physicians' offices. And so they're recommending for girls at age 10 and at age 12, and boys once at age 13 or 14, just to have their spine looked at as part of their routine health maintenance examinations. They wanted also to make sure that people are well trained in the method, and so the method of choice for screening is to have the child bend forward. And there's a tool called a scoliometer that is actually a little device that can actually tell you how many degrees of elevation that one side of the chest has compared to the other. And the recommendation is that if that's 7 degrees or greater, those children should be referred to an orthopedic surgeon for further evaluation. They're also that was the third point, and then the fourth point was that nowadays we're really, really careful about using as low as reasonably achievable radiation. So the radiographs should be done in a way that minimizes the amount of radiation exposure to the child. And of course, the Pediatric Radiology Society is very, very involved in developing recommendations for that. And then the fifth part of our statement is that we felt that bracing is an effective intervention and should be considered for children that have early scoliosis.
Right. So just to kind of summarize everything up, Dr. Schwend, early detection, early bracing, obviously, we want to encourage compliance there, and we could see many, many positive outcomes as a result, correct?
Correct. Yeah, so I think the really take-home message is early detection because there's effective early treatment now. It's non-operative. And the real ultimate goal of the brace is to prevent the progression of scoliosis to the point of needing surgery. So ultimately, we would like to, even though we're surgeons, we'd like to decrease the chance of a child having to have surgery.
Right. Dr. Schwend, I want to thank you for all the work that you're doing at Children's Mercy, and I want to thank you for coming on the show. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you can go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Michael Smith. Thanks for listening.